Have you ever felt totally drained for no good reason? Or maybe the complete opposite, so anxious and jittery you feel like you've had 10 cups of coffee? Well, for millions of us, the real reason is a tiny, super powerful gland working away silently in our necks. We're going to get into what it is and what happens when it goes haywire. I want you to think of your body like a car. It's got an engine, right? Or maybe a thermostat that controls the speed of absolutely everything, from your heart rate to how quickly you burn off lunch. Well, that engine, that's your thyroid. And today, we're going to pop the hood and see what happens when that engine sputters and runs way too slow, or when it redlines and goes dangerously fast. All right, so before we get into all the problems, let's take a look at how this whole system is supposed to work. What exactly is this master controller, and how does it keep everything running in perfect harmony? So, right here at the front of your neck, you've got the thyroid gland. It's pretty small, but its job is huge. It pumps out hormones that basically act like the gas pedal for your entire body, telling every single cell how much energy to burn. It's the ultimate regulator of your metabolism. Now, the thyroid doesn't just go rogue. It's part of this super precise 4-step chain of command. It all starts up in the brain, which sends out a little signal. That signal goes to the pituitary gland, which is like the manager. The pituitary then tells the thyroid, hey, time to get to work, and the thyroid releases its hormones. And here's the brilliant part. Once the hormone levels are just right, they send a message all the way back up to the brain saying, okay, we're good, you can chill out. It's this beautiful, self-regulating feedback loop that keeps your body perfectly balanced. But what happens when that perfect loop breaks? Let's start with the first scenario. What happens when your body's engine just isn't getting enough gas to run properly? This is a condition called hypothyroidism. Hypothyroidism is basically your body being stuck in first gear. The thyroid just isn't making enough of its hormones, so everything slows way down. We're talking your metabolism, your thoughts, even your reflexes. It all just gets sluggish. And when your engine is running that slow, you feel it everywhere. You're tired all the time, and you're always cold because your body's internal furnace is basically on low. Because your metabolism is crawling, you might gain weight, even if you haven't changed how you eat. Even your digestive system slows down. And it can really affect your mood, too, sometimes leading to depression. So, what's causing this major slowdown? Well, most of the time, it's a case of friendly fire. With Hashimoto's disease, the body's own immune system gets confused and starts attacking the thyroid gland itself, damaging it so it just can't produce the hormones it needs to. Okay, let's slam on the gas and flip to the other extreme. What happens when that gas pedal gets stuck to the floor and the engine is just constantly redlining? This is hyperthyroidism, the polar opposite. Here, the thyroid is pumping out way too much hormone, sending your entire body into overdrive. It's like you're running a marathon 24/7, and let me tell you, it can be just as exhausting and dangerous as running too slow. And the symptoms absolutely reflect this out-of-control speed. Instead of feeling depressed, you're hit with anxiety and irritability. Instead of being cold, you feel hot and sweaty all the time. Your metabolism is burning so fast, you start losing weight even though you're eating constantly. Your heart is racing, your hands might shake, and trying to get a good night's sleep? Forget about it. And just like with the slowdown, the most common culprit here is another autoimmune condition. It's called Graves' disease. In this case, the immune system creates these rogue antibodies that perfectly mimic the go signal from the pituitary gland. So they basically trick the thyroid into working overtime, nonstop. When you put these two conditions side by side, it's really incredible. They are truly two sides of the exact same coin. You've got feeling cold versus feeling hot, weight gain versus weight loss, a slow heart rate versus a racing one, total fatigue versus wired anxiety. Seeing them like this makes it crystal clear how one little gland can create such completely different realities for people. So, how do we fix this? How do doctors figure out what's wrong and get the body's engine tuned up and running at just the right speed again? Well, it usually starts with a simple blood test that checks two really important things. First, the actual level of thyroid hormones, like T4 in your blood. And second, the level of TSH, that's the signal coming from the pituitary gland. Now, think of it this way. If your thyroid hormone is low, your pituitary has to shout to get it to work. So your TSH level will be high. That points right to hypothyroidism. But if your thyroid hormone is too high, the pituitary whispers, so your TSH will be low. That signals hyperthyroidism. it's the simple inverse relationship that gives doctors the answer. And once you have the diagnosis, the treatment goals are really straightforward. For a slow engine, you gotta add more fuel. That usually means a daily medication called levothyroxine, which is a synthetic hormone. For an engine that's running way too fast, you need to hit the brakes. That can be done with medications that block hormone production, a treatment with radioactive iodine that shrinks the gland, or in some cases, surgery.
Okay, let's wrap this up with the most important part: why this all matters to you. Because beyond just feeling off, not managing your thyroid health can have some really serious consequences, especially for certain people.
And the stakes here are incredibly high. During pregnancy, a mother's thyroid health is absolutely critical for the baby's brain development. For kids, proper thyroid levels are essential for them to grow and develop normally. And for the elderly, it's so tricky because symptoms like fatigue or brain fog are so easily written off as just getting older, which means it gets missed all the time. Living with a thyroid condition means you have to be an active partner in your own health. It's about small but vital habits, like knowing to take your hypo medication on an empty stomach. It's about smart lifestyle choices, like avoiding caffeine if you have hyperthyroidism. And this is really important. It's about knowing the signs of a true medical emergency, like a thyroid storm, where the body's metabolism speeds up so fast it becomes life-threatening. So the next time you feel off, whether you're just dragging yourself through the day or you're buzzing with anxiety that came out of nowhere, it's worth asking yourself this question. Your body is constantly sending you signals about how its internal engine is running. The key is to learn